Sigmund Freud, born on May 6, 1856, in Freiburg, Moravia, now part of the Czech Republic, was an Austrian neurologist and the founder of psychoanalysis. He is widely regarded as one of the most influential figures in the history of psychology, and his work has had a lasting impact on the fields of psychiatry, psychology, and psychotherapy. Freud's early life was marked by academic excellence and a keen interest in the workings of the human mind. After studying medicine at the University of Vienna, he pursued a career in neurology and began conducting research on the nervous system. Freud's early clinical work focused on the treatment of patients with neurological disorders, but he soon became interested in the psychological aspects of his patients' symptoms. In the late 19th century, Freud began to develop his theories on the unconscious mind and the role of repressed desires and memories in shaping human behavior. He conducted self-analysis and explored his own dreams and fantasies, which influenced his understanding of the inner workings of the mind. In 1895, Freud published his groundbreaking work, Studies on Hysteria, co-authored with Joseph Breuer, which introduced the concept of psychoanalysis and laid the foundation for his later theories. Freud's theories were met with both fascination and controversy. His emphasis on the role of sexuality and unconscious drives in human behavior challenged prevailing Victorian attitudes towards morality and propriety. Freud's ideas about the Oedipus complex, infantile sexuality, and the unconscious mind were considered scandalous and revolutionary at the time, but they also sparked a new way of thinking about the complexities of the human psyche. In 1900, Freud published his seminal work, The Interpretation of Dreams, in which he outlined his theory of dream analysis and the significance of dreams as expressions of unconscious desires. This book solidified Freud's reputation as a leading figure in the field of psychology and laid the groundwork for his subsequent work on psychoanalytic theory and therapy. Throughout his career, Freud continued to refine and expand his theories on the structure of the mind, the development of personality, and the mechanisms of defense mechanisms. He introduced the structural model of the mind, consisting of the id, ego, and superego, and explored the ways in which unconscious conflicts and desires influence our thoughts, feelings, and behaviors. Freud's clinical practice also played a crucial role in the development of psychoanalysis as a therapeutic method. He emphasized the importance of the therapeutic relationship and the process of free association in uncovering unconscious conflicts and resolving psychological symptoms. Freud's case studies, such as the famous Dora and Little Hans cases, provided valuable insights into the dynamics of psychoanalytic treatment and the complexities of human behavior. Despite his groundbreaking contributions to the field of psychology, Freud faced criticism and controversy throughout his career. His theories were seen as reductionistic and deterministic, and his emphasis on sexuality and the unconscious mind was met with skepticism by some of his contemporaries. However, Freud's ideas continued to gain influence and popularity, leading to the establishment of the psychoanalytic movement and the founding of the International Psychoanalytic Association in 1910. In the later years of his life, Freud faced personal and professional challenges, including the rise of Nazism in Europe and the onset of World War II. In 1938, he fled Austria with his family to escape persecution and settled in London, where he spent the remainder of his life. Freud continued to work and write until his death on September 23, 1939, leaving behind a rich legacy of ideas and a lasting impact on the field of psychology. Sigmund Freud's life and work are a testament to his enduring influence on the study of the human mind and behavior. His theories on the unconscious mind, dream analysis, and psychoanalytic therapy have shaped the development of modern psychology and continue to be studied and debated by scholars and practitioners around the world. Freud's legacy as a pioneer in the field of psychology remains a cornerstone of contemporary psychoanalytic theory and practice.